Hello, my name is Gabriela Gobbi. I'm a professor of psychiatry at McGill University in Montreal, Canada, and I'm the secretary of the CINP. Today is a pleasure for me to introduce you our winner from the Rafaelsen Young Investigator Award. This year, 2022, was Jennifer Phillips. Dr. Phillips is a scientist in the Mood Disorder Research Unit at the Royal Institute of Mental Health Research in Ottawa, and she's assistant professor at the University of Ottawa. Hello, Jennifer.
Hello.
So I would like to ask you some questions about yourself, your career, and this prize. So the first question is, why have you chosen to become a researcher in mental health? Can you tell us a little bit more about your trajectory?
Sure, yeah. I think mental health feels like one of the last frontiers of medicine because the brain is so poorly understood. A lot of my background is in biology before moving into neuroscience. We know that most mental health conditions can be treated pharmacologically, and yet even if we understand the pharmacological or mechanism of action of a medication, we still don't necessarily understand how those mechanisms lead to its therapeutic effects or the reduction of mental health symptoms. So I think within the field, there's just so much opportunity, there's so much to discover and understand, which makes it a challenge, but it also makes it really rewarding to be working in mental health research.
Mm-hmm. What is now your main research interest and topic that you are investigating right now?
I'm working in developing a research program in clinical neuroscience, and I'm working in depression and suicide prevention, specifically studying in patients with treatment-resistant depression, looking at suicide-related outcomes using brain imaging. So we know that in treatment-resistant depression, there's very high rates of suicidal ideation. About 30% of patients will have a suicide attempt in their lifetime. So it's a population where there really is an opportunity to sort of try to better understand the neural correlates of these suicide-related outcomes. So I'm using multimodal neuroimaging, MRI, as well as pairing it with treatment with ketamine, which we know can decrease suicidal ideation, to try to understand the differences between ideation and attempts in the brain, and what neural changes are associated with the alleviation of suicidal ideation with rapid-acting antidepressant strategies like ketamine.
So can you tell us what this Rafaelsen Young Investigator Award represents for you?
Yeah, I was truly honored to receive the CINP Rafaelsen Young Investigator Award. For me, it's just really exciting to have recognition for one of my first sort of independent projects and to have my work recognized. It was really a great opportunity to be able to present this work at the most recent CINP World Congress. And it feels like a recognition for my mentors, as well as the students I'm mentoring who are building my research program kind of alongside me.
Mm-hmm. Nice. So please tell us what is your dream as a scientist? Which are your future plans?
Well, I think one of the biggest challenges still is the lack of response or delayed response in depression for many patients with existing therapies. I really hope to advance treatment of depression by better understanding its biology and how that biology interacts with psychosocial factors or history, as well as clinical symptoms. And I'm really hopeful that for me, I would hope that my work is relevant to the needs of those with lived experience of depression, as well as relevant to be translated into clinical practice to actually have a meaningful contribution to improving outcomes for people with depression.
Thank you very much, Dr. Phillips, and good luck for your career.
Thank you.